So we move on to another area of that advocacy for capacity building in digital health from a friend of Ahin, who was actually there from the start. So we will hear, please welcome Mark Landry from the Global Fund, which was created essentially to fight or defeat HIV, TB, and malaria. And now he has evolved into another position. He has moved on to another position. And he is now the Senior Specialist Country Digital Health Information Systems of the Global Fund. And he's now based in Geneva. So let's welcome Mark Landry. Hello, Mark.
Hi, everyone. Yeah, greetings from Geneva. Apologies, I can't be with you in person this year. I feel like I'm a delinquent attendee this year, and I apologize. It's my pleasure to still share with you in this new role that I have now with the Global Fund that we're embarking on some additional intensive support that we want to both provide through our grants, but also through catalytic resources through our secretariat, really to enable more of an applied learning approach to the capacity development needs of countries in their digital health journey. And specifically, I wanted to maybe share the context that, so we're in the middle of the beginning of the next grant making cycle. So every 3 years we have a replenishment conference. This was held just last month in New York, hosted by the government of the United States. And we mobilized as much of the funding that we can possible. We had a target of 18 billion, but we were still able to mobilize over 14 billion towards eradicating AIDS, TB, and malaria. And within that envelope for a 3-year investment, if we look historically, the last 3-year cycles, there have been investments of close to 200 million, and then last cycle, nearly $300 million in digital health and health information system strengthening. And so to speak to the second point, of course, we recognize time and time again that these investments are critical not only for our primary focus of eradicating these 3 diseases, but also more recently COVID-19, and of course, helping with overall health system strengthening. Take, for example, in Myanmar, the Global Fund has supported the development of a master patient index, originally from the needs in the HIV program, but that's become a resource for the whole public health sector. Or as we are now investing significantly in Sri Lanka, helping them with their digital health architecture framework and operationalizing that through an interoperability plan and a capacity development plan. So we recognize the importance of really trying to maximize our investments. The third point really is, this is really taken from what I think AHIN has discovered through its history. What are the common challenges and issues? And they keep coming back to capacity around gaps. And the GAPS initiative really inspired us to think about how can we invest more in governance and architecture development, to think about strengthening program management aspects, and as well as the need for standards and interoperability. So these are hallmarks of this new initiative of ours as well. And so the last point is we are going to begin investing heavily in a number of countries intensively, and also other countries we want to have some influence with some more moderate levels of support. So this is our footprint at the moment. This is just the beginning. We've identified 6 countries that we want to provide more intensive support, 2 of which are in Asia, Sri Lanka and Bangladesh, as well as a number of other countries that we want to rely on the regional communities of practice, including AHIN, to have more capacity to have more influence. So I would say off the top, if your country is not in yellow, that's okay, because we're going to be working through AHIN. AHIN has just qualified, and this is news to the group, as a TA provider to Global Fund, and so we'll be soon be able to work directly with AHIN to provide additional support through the network to many countries across the entire network. But I share this slide to give you a flavor of the fact that we're trying to think more critically about working more effectively through better local coordination with partners. You can see a number of these little dots identifying different donors and development partners that we've already begun to engage with, to work with. So we're geared up and ready to try to optimize the support that we can provide through the local coordination mechanisms and governance structures, of course, country-led, and support digital health strengthening and digital data systems and health information systems strengthening more effectively accordingly. I also want you to note there is this little blue icon on the Philippines and Thailand, and these are a couple of the AHIN standards and interoperability labs. We're going to be working with AHIN to help embed a similar type lab in Africa. And we're in discussions with the WHO regional office there in Brazzaville, but also thinking about working through Helena, another health informatics group that is supporting the African continent. So stay tuned on that. We'll be having discussions around that in the weeks ahead. And of course, we're also working through, you heard from Sean Blaschke earlier through DICE. They're helping us with this process as well. So what is it that we want to do? Well, I mean, we have some very noble high-level goals, ultimately to improve the quality, analysis, interpretation, and use of data that is being derived from these digital systems. And so we want to contribute to national, regional, and global digital health information system strengthening. And we want to help guide processes for making more strategic investments accordingly. I mentioned the third goal there, focusing on the data analytics aspect. So what are the types of benefits that we think we can realistically derive over the next few years in these intensive supported countries? Application and use of the digital public goods that are becoming widely recognized as the be-all, end-all, most normative and best fit for purpose tools and techniques, platform services, digital interventions, etc. So we want to continue to promote those. We have in mind a number of different pathways for strengthening the institutional capacity that is needed. As I mentioned, using a lot of the same, and you'll see in a moment, techniques that are promoted by AHIN through the GAPS initiative itself. And of course, we're committed now, as we see countries trying to translate their digital health strategies into action, that it has to go through a health enterprise architecture framework, full stop. And so developing roadmaps to do this appropriately and systematically and to curate that architecture framework is going to be, I think, the foundation or bedrock for sustainable and development of durable digital health ecosystems going forward. And so as we think about this going forward, we realize there'll be a number of other derivatives through a regional approach as well, and want to work with AHIN to go about that. So just to give you a flavor of the kinds of support we have envisioned, this graphic on the left is taken from the WHO Digital Implementation Investment Guide, or DIG, where this is nothing new to anyone, but it just helps us recognize this cascade of moving from the strategy to an investment roadmap, using architecture, using that to drive decisions around the applications and interventions that are implemented, and ultimately to institutionalize this through capacity development programs. And you heard from Merrick as well earlier today from USAID, and many of you are enrolled to this digital health leadership course, which is excellent. But there are a number of other wonderful examples and modalities that we want to promote, including twinning methods through, both through academe, but also using existing partners that are demonstrating their effectiveness. Take, for example, in Sri Lanka, in the University of Colombo, with their um, biomedical informatics program, taking medical doctors out of the Ministry of Health, training them, certifying them, even with master's degrees and PhDs, and then they are returned back into civil service and are able to apply those very high level skills and have the competencies to improve the digital health capacity within the ministry very effectively. So on the right, this is actually something that was developed by AHIN and WHO to really think about taking advantage of the types of standards and interventions and techniques from the IT sector, going from strategy to fully implementing a program management style approach to the maturation of the digital health ecosystem. So I'm pleased to say that we have seen and observed how AHIN has used trainings in COBIT-5, in TOGAF, even in PRINCE2 for program management, and using the OpenHIE program to certify folks in the region. These need to be continued, and more importantly, need to be applied. And our approach will be to use these techniques, but also have a feedbacking mechanism and loop to see how these can be implemented effectively. And just to reiterate, I appreciate what Merrick said this morning as well about their post-evaluation, that they actually observed close to 60-70% of individuals that had taken that particular course on digital health actually started to use that in their day-to-day work. And then finally, what kinds of results do we want to achieve? Well, we want to work with countries, and this isn't just the ones as part of this initiative, but all countries that will be applying for grants this next cycle to ensure that they can be recognizing the importance of having a costed and detailed strategy and action plan, the importance of, and I'm providing some references there, including that document, the Digital Implementation Investment Guide, or DIG. The second point around the governance, we heard a lot about data governance, but it's also very important around the digital health governance. I think there were some wonderful country presentations earlier on this today as well. There's a great ADB working paper where I think Alvin Marcello and others wrote to this and how to operationalize digital health governance, which is a good resource. Utilizing enterprise architecture frameworks and developing health information exchange, interoperability roadmaps, et cetera. Also, as I mentioned, the importance of having a capacity development plan. And then what about how do we best inventory and maintain rich specification details of the investments that have been made, and how those can be influenced and adhering to, and ultimately in compliance with this architecture framework using the Digital Health Atlas. And finally, it was very early for me. I didn't hear Patty Michelle speak this morning around the Global Digital Health Index, but we endorse it. We're going to be using that in our approach to track and look at the maturity of digital health maturity of countries. So this is a flavor of some of the measurable results and investments we'll be supporting and encouraging. And the last thing I want to say is that we have, like I said, just embarked on this next grant making cycle. What happens next is what we call the allocation letters will go out to each country, telling them their eligibility and a dollar amount, whether it's HIV, TB, malaria, or the resilient and sustainable systems for health pillar. Those are the four main funding mechanisms or grant mechanisms that we have. Under that, under the RSSH, the Resilience and Sustainable Systems for Health grant, if your country is eligible for that, and this is public knowledge, and this will be available sometime in December or January, please approach your country coordination mechanism, Secretariat or CCM, find out what is the feasibility to embed some of the priority needs for digital health that you might have in your country into that RSSH grant. And I'll leave in the chat as soon as I finish a reference to an information note on this. It gives explicit guidance that if investments are going to be made in digital health or health information systems, these are the recommended aspects of that we would like to see in that grant. And this year, for this cycle, you're going to see a lot of the things I have talked about around investing in the digital health foundations that are required for sustainable and scalable digital health. So please take advantage of this next grant making cycle. Take advantage of this initiative that we're supporting through the Secretariat, and look forward to the opportunities that we will share as we work with AHIN to promote and support your digital health journey throughout Asia and the Pacific. Thank you very much.
That is really interesting, and I hope the countries are listening for all of these opportunities. And while ultimately we want to see HIV, TB, and malaria actually eradicated, and it does work to invest in all of these tools, the digital health systems, to make it work. There are two questions on board. Alvin first.
Hi, Mark. Good morning. I just wanted to say that we miss you, and thank you for nurturing Ahin all this time. And we have a fan here, Charity. Look at the camera. The whole Philippine team here is rooting for you, Mark.
I miss you, Mark. There you go.
They want to say hello. Thank you, Mark. Thank you. Dr. Bunchay has a question for you.
Good morning and good afternoon here, Mark. We really
Hi,
miss
Burchai.
you. You for the AHIN member, you know, if we have a founding father, Mark is our founding father. So we really miss you this year, but next year you should not miss us, right? And we work on the creating this e-health and digital health community in Asia, and you are the power that propel us advance and still pushing us on this, and we are very grateful to your support. But we will do what we have passion, like you, like all of us, to build the community of digital health and e-health in the and build the effective health information system. I don't have the question. I know that all that the work that we have done for the last 10 years, and this is the 10-year anniversary. I still remember the day that in WHO Wipro that we have a conference, and we first met, and then we starting these communities. This is all I have to say, that we really miss you.
Hi, Mark.
You too. Hi.
Hi. This is our 10th year anniversary. So we really miss you. We really hope you are here, and being one of the founding member of AHIN. So again, thank you very much, and we hope you can join us the next time.
Thanks, Mark, for staying awake or getting up very early and being with us throughout the day. I could see that you're following with us. And then thanks also for giving us the good news that we are eligible to receive and then support countries with the TA. Thank you very much.
Our pleasure.
In the audience are representatives from Sri Lanka. So there's much emphasis or support for Sri Lanka on from Global Fund this year. Would you like to say something, sir? Dr. Hassan, or okay.
Thanks, Mark. Actually, it's a wonderful way to meet. Mark is there actually supporting our architecture blueprint development and concurrently developing human resource development plan and interoperability plan. I think things are going really well now, even though there's a little bit delay initially. So I think from our end, we are working very hard to achieve these outcomes, strengthening the health information system, ultimately benefiting the patients and the health planners. So I would like to thank the Global Fund for actually investing in difficult times, especially for Sri Lanka. Thank you, Mark, for your guidance, and we continue to looking forward for your and Global Fund visit to Sri Lanka, hopefully near future.
Great, thanks. I know I'm over time. I just wanted to mention quickly that one of the things I want to do with AHIN is to eke out a lot of the learnings from the experiences that are happening. We've heard about many of these stories today from India, from Malaysia, from others, and what's happening in Sri Lanka. So please, let's also think about how we can extract all of this good practice to inform the rest of the world. I think there's a gold mine of reusable learnings that I think will really help, particularly Africa. And so keep that in mind. We'll be coming back to you to talk about that kind of a process to really harness and canvas and hoover up all of this extreme learning and put that more into practice and benefit the world. Thanks so much. I really appreciate the time. Thanks, Portia.
Thank you, Mark. One more message from Dr. Chansley of Lao.
Hi, Mark. I just realized that you are joining the Global Fund because we have one big project in Laos joining between the World Bank and Global Fund, but more focus of the funding is more on the service delivery of the TB HIV rather than digital health. I just like you to request you to talk to the maybe Global Fund portfolio manager to invest more on digital health. Thank you.
Well noted, Chansley. I will do that. Thanks so much.
So we will count on you, Mark. So see you again. Thank you again. Cheers. Okay. Okay.